At 12:54 local time, we administered 100 million total vaccine doses. Our vaccination campaign against COVID-19 started on January the 13th, when the President set an example for our citizens and received the first shot. I would like to thank our President for leading such an important social movement. Congratulations on delivering 100 million doses to our 84 million citizens.
All right, what does this mean? Let's speak to Derya Unutmaz here in Istanbul. He's an immunologist over at the Jackson Laboratory. Derya, good to have you on the show. Let's be fair. I think quite a good milestone, given the fact that Turkey perhaps wasn't as quick as it may have wanted to be, especially at the beginning of this pandemic when vaccines first became available.
Yeah, sure. I mean, even though this is a symbolic number, it is a major milestone. And actually, if you look at the proportion of the population who has been vaccinated, either first dose or second dose or third dose, Turkey is ahead of a number of countries, including U.S. Population, because I think as of today, more people have received the first dose, and I think in a couple of days, more people over the age of 18 will have received a second dose compared to the USA population. So it is a major milestone, I think. And if we continue at this rate, it's going to have a major impact too.
Derya, tell me this. In some countries, since you mentioned third doses, I mean, booster shots is sort of the main talk. How important is this going to be as we battle, not only as Turkey, but other countries, third, fourth, and possible more waves after that?
So the third dose in Turkey was really critical because the first two doses for the population who had the highest risk, elderly and healthcare workers, the Sinovac, the inactive vaccine, was administered, and that was the one available at the time, and it was the right thing to do. But unfortunately, that vaccine didn't have a very long-lasting effect. And the immunity was going down, as well as the Delta variant was making it less active, less protective. So the third dose decision was really very, very important, and I think about 10 million people have received that. Now, those who have received two mRNA vaccines, such as BioNTech or Moderna, I think they don't have to worry about the third dose just yet. From the data from Israel, we know that after 6 to 8 months, some people will have lower immunity after even the second dose. So the idea is to start having the third dose after about maybe 8 months, starting with the risk populations. I think that will also happen in the U.S. But people shouldn't think of this as like, are we going to have a new vaccine every 6 months? No, I don't think so. The third dose is really to remind the immune system that this is something really dangerous, and don't forget it soon. And I think that will have both impact on protecting against Delta variant and maybe other variants, but more importantly, will have a longer lasting effect from an immune system point of view.
Derya, I don't have a lot of time left, but we know that Turkey has been working on developing an indigenous COVID vaccine. Tell us a little bit more about that.
So I think there are a couple. One of them, which is most advanced, is an inactive vaccine, which is very similar to the Sinovac Chinese vaccine. And I think it's in phase 3 trials. So we should know about the results in the next coming month or two. There's another vaccine called virus-like protein vaccine. It's a very innovative vaccine that has just completed the phase 2 and starting phase 3. So both vaccines have promise. So we're looking forward to the results for those.
Okay. Derya Unutmaz, sorry for mispronouncing your name in the intro. I do appreciate your time and your analysis. Thank you.